Hello, this is Bill Shergi from Huntsville, Alabama, winding down at the ACR. But I want to talk about one very exciting program that I attended, and this is one that I think all of us in rheumatology need to focus on. It was the guidelines for reproductive health in all of our rheumatology patients. And I'm always a little skeptical to hear these guidelines, but I was so impressed by the amount of work put into by the committee. They reviewed over 12,000 articles that were put forth by obstetricians, maternal fetal medicine, endocrinologists, reproductive endocrinologists, along with rheumatologists and experts in the medicines that we utilize. And they then whittled it down to roughly 320 that were up to muster to be reevaluated. And it's from these that the guidelines and suggestions have been proposed. And this covers contraception, it covers drugs that we utilize, it covers what to do with flares. So it's a very nice topic. But some of the highlights, very clearly a point that came out was that the patient really views her rheumatologist as the prime provider of information. And there was a committee of patients that advised the panel, and they made it clear that they feel more comfortable with their rheumatologist than their gynecologist. And so we need to be familiar with this. We also need to bring up these discussions early on and often as well, because as we all know, pregnancies can come at any time, no matter what the best laid plans may be. And it's important for that discussion to have taken place. The idea with the medicines, certainly we use the safest medicines for the patients. However, what has also been driven home is that this is not so much driven by what is dangerous to the baby, but more in keeping the mother healthy, keeping her disease under control, because that is what will allow the best outcome for the fetus. And so I urge you to look at some of these guidelines. The major ones were simply use the most effective contraception if the patient is looking for contraception. If the person is with active lupus, or if they have a positive antiphospholipid antibody, you should not utilize estrogen-based compounds. But one interesting fact was that estrogens were deemed safe for the postmenopausal lupus patient for symptoms in the same fashion of using the lowest effective dose. Clearly, if they have phospholipid antibody or if the disease is active, we would not recommend this. And looking at our RA patients, keep the disease under control. TNFs are generally felt to be safe. The recommendation in the guidelines is into the third trimester, and then consider removing them, although they did make point that our GI colleagues will frequently use TNFs throughout the entire pregnancy to keep inflammatory bowel disease under control. So with that, I urge you to make yourself familiar with some of the other contents of the article. It will be hopefully coming out within the next year. These guidelines are available in abstract form, and I think another useful aspect of these would be to discuss them with your patients and also to discuss them with your colleagues, because we as rheumatologists need to be involved in the management of our pregnant patients. We don't want to let the control of our lupus patient who's pregnant strictly to the obstetrician. So it's a team effort. Everyone needs to be on the same page. And with that, I say thank you and keep coming to the ACR.